you're not supposed to know anything, and that's why know everything, and that's why you do an internship.
I was going to say, you know a lot. Don't discount. That's the one thing you can't do as an early career grad, is discount the fact that you think you know nothing, because you know so much. Now you just got to go through your brain and realize what is actual crap and what you actually are going to use all the time. I want you to keep up the good fight. I want you to keep learning. I want you to do all the things you want to do. But just remember that there's those of us who are there if you have those bad days and you need someone else other than your mentors at school to give you a swift kick in the ass, or, because that's what we're here for. And I really think, as far as these check-ins, I think it's going to be very beneficial for all the young veterinarians that are thinking about internship or just started, because there's no difference between what people are going through, your classmates that went right into practice, and what you're going through. The difference is that they're dealing with it real time and referring those cases to you that are a little harder. How is Georgia versus Wisconsin?
Any person in this profession that you look up to, or you want to be like, or that you see as a mentor, they have had these feelings before, and they have felt what you are feeling right now, and that it's not uncommon, and everybody has been through this before. Because there are times where you are in those moments and the imposter syndrome creeps in, and the emotional stress creeps in and can kind of perpetuate those negative thoughts. And I would tell them that you are not alone, because everybody has felt like that. Some people just may not tell you that or may not share that.
Hello, everybody. 4 months ago, Dr. Rostas graduated with that shiny new DVM degree and a head full of big dreams, work-life balance, personal growth, maybe even weekends off. Fast forward to today, he's canceled on me 3 times. He's running on caffeine and compassion. He's learning that the real education starts after the diploma. Today, we're diving into what the first quarter as a real veterinarian actually feels like on an internship. The exhaustion, the unexpected wins, the nights you questioned everything, and the quiet moments that remind you why you chose this profession in the first place. This isn't about perfection. It's about progress. It's about what happens when the fire hose hits you in the face and you keep showing up anyway. So buckle up. This is not a highlight reel. It's Irreplaceable Truths with Dr. Jake Rostas. Dr. Rostas, how are you, man?
I'm doing good, man. It's good to see you again. Appreciate you having me back on.
Oh, yeah. Well, I told you, for all the listeners, I'm going to check in with him every quarter because I'm really curious. You're kind of like my guinea pig. I'm an academician now, so I'm going to have to follow some of my little experiments and see how they're doing, making sure they're keeping their wits about them. So I got a question right off the bat. How long did it take the internship to humble you?
Yeah. I guess pretty early on. I think going into the internship, I knew that it was not going to be easy by any means, and that it's going to be a different kind of experience, and it's going to challenge you a lot regularly. So I think my expectations have kind of met reality. But I think just the way it pushes you in a different way from when you were a clinical student is surprising, and was a lot more so mentally exhausting than I expected. And it mainly comes with, there's a lot of pressure on you when you are the clinician now. And it is a kind of a switch in mindset that causes a lot more stress for you, and makes you really, really have to think through every decision. And so it's been eye-opening for sure, but I would say that my expectations have matched reality. And overall, I mean, I've grown tremendously daily with what I'm learning, decision making, and kind of the mentorship and guidance that I've been exposed to throughout the internship has been truly a blessing. Also, another side point, if you want to talk about how humbling it is to be around such phenomenal clinicians that are so good at what they do is also humbling in a way that's not, it's a way that's very inspiring, because there's a lot of good talent and skilled clinicians that are tenured, and you want to be like them one day. So that has been humbling in itself as well.
How many cups of coffee are powering this conversation right now?
It's more so energy drinks for me. I
Hey,
got
still on mine too.
yeah.
I get to interview my mentor. He's finally coming on. Took me forever to get him, and he always taught me, he said, the 3 food groups are caffeine, nicotine, and alcohol.
Yeah. I mean, it's crazy what you do to get through some of this stuff. I mean, I am kind of regularly drinking like 300 to 600 milligrams of caffeine a day.
Yeah. What was the first case, or what was the first time when you realized, oh crap, I'm actually the doctor now?
I guess really just the first case I ever had, because instead of, and it was kind of like with the moment when you go and talk to the client, it kind of, as soon as I walked into the room, it was a shock, just being like, I'm the one that's going to be discussing these things, and I am looked at as, my patient's primary doctor. And there's a different kind of feeling you have when you have to go talk to the owner and explain things to them, and also like earning their trust by being educated and kind of establishing that rapport with them. So it was really like the first case I walked into, that moment of speaking to the client directly was kind of that realization. And I still get a little bit, I double take a little bit now when people say Dr. Rostas instead of Jake. Which is kind of fun.
Are the fourth years calling you Dr. Rostas? Because they're only about 8 months behind you, right?
Yeah. And most people, pretty much anybody, I just say, you can call me Jake if you want. I don't need to go by Dr. Rostas.
Yeah. Oh yeah, exactly. The only time they should really do that, obviously, is in the rooms. But but when you're outside, yeah, exactly. When people try to call me Dr. G or Dr. Gersh or Dr. Alaluf or anything, I'm like, no, no. Gersh is fine. G is fine. But when you're in front of the clients, that's something that's just kind of a hierarchy thing. So you promised me work-life balance. How's that coming along?
So I think when we last spoke, we were talking about running, and we were talking about when you have the difficulty with time management, how are you going to be able to run as much as you do? How are you going to be able to do these races and make time for that kind of stuff during your internship? And I was like, well, I'm going to essentially, my focus is to do my internship and become the best doctor that I can be. So if it comes with sacrificing some of my running, I'm going to have to do that, which that has definitely been a struggle in terms of balance. But I kind of have gone under the impression of this internship is I'm going to be unbalanced, and I'm not. It's okay that I'm unbalanced right now, because I'm trying to work so hard and grow and learn and accelerate in basically everything that my goals are, that with that, you're going to be unbalanced for a while. So I think it's okay that I'm unbalanced, as long as I'm not jeopardizing my ability to be a clinician. And if that takes me sacrificing some of my running, it's definitely been a case. I've not been able to run nearly as much as I would like to. But I did also say that even if I wasn't able to train as much as I could, I would still sign up for those races, and I would still show up on race day and do the best I could, which I did recently complete an ultra marathon about a month ago, in which I actually won. It was the first ultra that I've ever won. Which
you tapered
in
you
preparation.
Tapered in. you were tapered.
I've been tapering since my internship started, but that was like, I still showed up on race day, and I was like, I am so undertrained. I'm so under, prepared for this race. but here we are, and we're just going to do our best.
Now that you're not running so much, it's more, ultramarathon running is an addiction. Believe it. I feel as if it is.
Absolutely.
Are you having issues with it mentally? Like, did you need that ultramarathon training in order to clear your mind? And if so, what are you using to clear your mind now?
Again, what a wonderful question. You always ask the best questions. Yeah, so the ultra running for me has always been something that's been like kind of a pillar in a sense of my mental health and, being able to channel some of any emotions I have, or being able to kind of put my body and my mind in a place where I'm kind of going to be more open to thoughts. I've always thought that when I go on a run, I always come up with my best ideas. I actually thought of one of my research ideas on a run, and I've been able to think or kind of unlock a new way of thinking on some of these on my long runs. So knowing that it's such a pillar for me, there are days where I feel maybe a little bit overwhelmed, or I feel in a sense more stressed out than I normally would be. And those are the days where I'm like, okay, I have to go for a run. Even though I may not have the time to do like an 8-mile run or a 10-mile run that I would normally like to do, it's still just the feeling of going out and doing a 1 to 2 mile run in the 20 minutes I have in the morning before I have to go to work. Is that makes leaps and bounds for me. And then that brings me momentum, and it kind of carries me that momentum throughout the rest of the day and into my work. So I would say that yes, it is a absolute pillar for me. And it's been a little bit of an adjustment not being able to have that as much. But I still, even though I cannot immerse myself as much as I would like, I still make it an absolute priority to do at least something, because I'm not going to just sit and do nothing and just sulk in the fact that I don't have time to run as much as I could, just because I view it as such a priority. And that so no matter what, I'm going to make at least something happen.
Can you break down your average week for the listeners out there, especially those that are thinking about doing internship or have accepted internship? Like, what's your average Sunday through Saturday like?
Yeah. So I will say that an internship is going to be a challenge, and it is going to push you. But I'll tell you that that is where growth is being challenged and being pushed and being uncomfortable, and, being surrounded by mentors that are so educated and so, good at what they do. So, going into it, I knew it was going to be a challenge. And every day I essentially, depending on what rotation you're on, you will work Monday through Friday, and the days are going to be long. It's not, you may be there longer than you thought you were going to be, but that's what your patient needs, and if that's what you have to do, you kind of got to accept that. And then afterwards, so I work probably anywhere between 10 to 12 hours a day. Some days are a lot less than that, which is nice depending on which rotation you're on. And then at night, with me wanting to do a specialty, I will then come home and either finish up my paperwork that I have to do, or I will work on my research projects. And I usually do that until, 8 p.m. or whenever, I feel like I'm losing my mental capacity to have good output of work. And then I will go to the gym and I will do something for myself, whether it's running or lifting. And then I'm usually in bed by like around 10 p.m. And then I'm there in the morning again at like 6 to 7. And that is a normal like week. And then over weekends, you have, inpatients that you are responsible for. So you learn a lot about time management. You're not in every day on the weekend. And there's also throughout the week, there's round sessions where you get, as interns, part of your internship training is there are formal round sessions, and which are really just lectures, and kind of the specialists will come in and give you particular topics they lecture you on, which is really, really useful, especially when you're on like an ER overnight, to kind of have that sense of, how to work up a case like this, or what they would need if I'm transferring it to them. And then, also we do a lot of like internship bonding experiences. Like me and my internship mates are phenomenal, and I'm very lucky to have a good group that we all get along very, very well with. And they are very, very supportive of each other, which is awesome. And we try and hang out as much as we can. So it's very, very busy. I mean, you're doing stuff every day, 12 hours a day, 15 hours a day, whether it's in the hospital or not. And it also depends on how competitive you want to be. If you want to do a specialty, you don't have to do research, but if you want to, get a residency, and putting yourself in the research world is definitely important. So depends, I guess, on also how competitive you want to be.
What's your
Long-winded
research?
answer to say it's
What,
busy.
yeah, what's your research like? What are you doing? Or you want to keep it
Yeah,
secret so no one else does it?
I'll probably keep a secret right now because it's not like anything that's out. But I'm doing a retrospective study, a case report, and also like a lab-based study. So I'm currently on like essentially 3 research projects, but they're all, some require a lot more work than others. Some I can sit on an ER overnight, and if it's dead in the ER, I can sit and just type on my laptop and write up medical record stuff. So yeah.
Have you thought of using AI to dive your medical records? You could
Yeah,
do a lot
so I
more
know.
medical records that way.
Yeah, absolutely. So there is more research, like actual research projects. Actually, one of the people I know here, had done a research project on utilization of AI to go through medical records and see how it compares to an actual human observer going through medical records. So I think there's still research out on how to do. There's actual research being done on utilizing AI for research. So it's like research inception. And I think that there's going to be a big, stretch of using that in the future. However, at this point, I'm kind of a nose to the grindstone person, and would rather just, bowl my way through things and sit at my laptop for hours and hours and hours and just get my work done myself, which
Yeah,
that's just where I'm at right now.
we'll readdress that at our next talk. See how
Yeah.
that's still going.
Yeah, that'll be
Because
the
I
next
mean,
topic.
even with me, with my when I started this doctoral journey that I'm almost done with, I was like, oh yeah, nose to the grindstone. This is how vet school was. You just got to grind, grind, grind. And then I realized, if you use AI, you can actually get more. You can use more articles. You can
Mm-hmm.
use more. You can ask more questions. You could do more interviews. You could do a whole bunch more than what the human can. Now, I'm not saying
Mm-hmm.
do your research completely with AI, but I look at AI when it comes to research now. It's more of that graduate assistant that PhDs used to have in undergrad. It's
Mm-hmm.
that's because when at least when I was going through school, you'd always see jobs for, hey, a PhD is looking for a research assistant to help study petroleum in the ocean. But that was because that research assistant was doing all that grinding, finding the articles, reading the articles, writing down stuff
Mm-hmm.
from the articles, and doing all that for the actual PhD, which is what AI is doing now. When I
Mm-hmm.
talked to my dean at Pepperdine about it, he goes, the only problem that they're coming up with right now is how do you give AI credit when it comes to writing the actual paper? So
Yeah.
that's the only issue right now. But
I have.
go ahead.
Oh no, I didn't mean to cut you off, but I have 2 points. And one that I also think is an issue is, with the acceptance of the being. How do you trust that AI isn't collecting the data on medical records? And the right to privacy is one thing that has come up that I've thought about, which I don't know the logistics of that, if there's actual rules or certain AI tools that prevent that, or have a legality agreement where they don't do that. So that's one thing I've thought about. And then just you made me think of this wonderful quote that I read in one of my favorite books. I think I quoted it last time too, but the book's called Complications. It's written by a human surgeon, and
I
he
read
was
it.
talking in
I
one of the
read I read it. You
really
made me read it. I read it. Absolutely, I read it when he was doing his internship and all that stuff. I read it as a surgeon.
Yeah, it's phenomenal. I love to hear your thoughts on that book. But one of my favorite quotes in that book too is he's talking about technology and its utilization for treatment in the medical world, and he was comparing basically robots like ability to basically do surgery versus like a human, and he was saying that, and this is how I think of AI, is that it is a tool in the medical field, and no matter what, that you can use technology to improve diagnostic interpretation. You can use all these things to, kind of help as a tool. But in the end of the day, in order to heal, you need a human hand.
You
And I
need
love
love.
that idea.
You need
Exactly. You
love.
need love.
Yep.
I couldn't agree more. Yeah.
So it's funny you bring that up because one of my projects I'm doing now is I'm trying to create an online digital journal for the Pepperdine Business School. And I interviewed one of my classmates who's studying how AI can lose patient dignity in human medicine. And he's a pastor. And that's the exact
Oh,
quote he
wow.
said to me. He goes, "What the problem is that in order to heal, you need love, and you cannot lose love in the
Hmm.
in the hospital room or in the exam room." And that's
Hmm.
exactly right. And I think the part you were talking about in that book was when he was going over the different cases towards the end of the book. I like the first half of the book a lot more than the second half, but it's a definite
Hmm.
must read for any veterinary student who's a senior. I'm
Yeah.
sorry. Because it's going to give you reality. Like, you're going to make
Hmm.
mistakes. You're not perfect. You're going to have to put the grind in it. And he was talking about when he lost his first patient, how it devastated him. And I actually have tried to reach out to him. I can't get him to write me back. I would love to have him on the show. I thought
Oh,
that
yeah.
book was incredible. If I do land him, you want to come on the show,
Okay.
right?
I was literally
Okay.
about to say that I'm inviting myself to that because I would love to pick his brain.
Yeah, it was amazing. He was really good.
Hmm.
Have you hit a
Hmm.
blank moment yet where you just kind of look at the owner like a deer in the headlights?
I mean, yeah, there's most certainly times where you're unsure and you know, you can't completely make sense of everything that's happening. And they ask questions, and that's the other thing with, like, I guess AI and like the ability to, like, the advancement of technology is owners can come in so prepared, and
Dr. Google, Dr. Chat.
yeah, exactly.
Yep.
Which honestly isn't the worst thing in the world, because then they ask good questions, and it makes me think as well. So, but there's most certainly times where I've only been a doctor for less than a year now. So there are most certainly times where I am, unsure, but I am always, asking my faculty, and I'm always honest with the owners too. If there's something that I need to check in with, or if there's something that I'm unsure about, I'll always run it by my faculty. And also, like, just in general, in an internship, you are essentially supervised the entire time. So, there is most certainly times where I feel that there are things that I don't know, but you're not supposed to know anything, and that's why know everything, and that's why you do an internship.
I was going to say, you know a lot. Don't discount. That's the one thing you
Mhm.
can't do as an early career grad is discount the fact that you think you know nothing, because you know so much. Now you just got
Mhm.
to go through your brain and realize what is actual crap and what you actually are going to use all the time. And
I,
that's the trick.
there are some moments where you're working up a case and it's like textbook from what you learned, and those are always like really fun, like, feelings, because this is just like, it's
But
like
that's
this is
few and far
exactly it's
between, dude. Those are so few and far
yes,
between. And most of the
it's
time
true.
they're at the University of Georgia in Athens seeing you because they aren't textbook.
Yeah, that is very true, which is a challenge in itself.
But that makes it more exciting, in my opinion, because I like
Yeah.
putting together the pieces and try to, be the Sherlock Holmes of the story. But if you do your internship at specialties, which that you have to, or universities, it's probably because not one, not two, maybe 3 or 4 veterinarians have tried to take a look at this and they just can't figure out what's going on, or they just figured out right off the bat, it is so complicated. We need to get you somewhere where they can handle this.
Yeah. Yeah. That is the majority. Most certainly a majority of the cases, correct.
So have you been through all your rotations already? Or are you just
No,
starting?
I haven't been through every rotation. But
What,
you know,
have you have a favorite?
I've been through it. I mean, I love surgery. That's all
I
I
know
want to
you're
do
going to
is
say that.
surgery.
That's
So
such a fucking softball I gave you. I apologize to
yeah,
all the
that wasn't
listeners. Which one surprised you the most? Which one did you go in thinking, and now you're like, oh, this isn't actually too bad?
I think my internal medicine service and blocks have been really surprising, just because, like you said, that they're usually very complicated cases if they're referring to an internal medicine at an academic. And essentially, it's you have the best, I would say, the best of the best doctors that are going to be on your on those cases, because they're boarded internal medicine specialists, so they're a walking encyclopedia. So I think, as grueling as some of those rotations were, because they challenge you so much and they make you think so much, and it can be frustrating because these cases you struggle to find an answer for what's going on. But I think the ability to kind of get a panel of diagnostics back and connect things and connect dots has been really enjoyable, because when you can kind of connect things to make sense, it's kind of like a eureka moment, which I've enjoyed a lot. And I will say, one of the with me wanting to do surgery, one of the large animal internal medicine doctors that I worked with at Madison, Wisconsin, made a comment to me, because he was saying, he's like, you would be a good internal medicine doctor. And he said the best compliment a surgeon can get is that they are a internist that can do surgery. And so I look pretty highly, I guess, on my internal medicine time, and trying to really get everything I can. That way, when I am, a
Right.
surgeon, I can manage the
Please,
complex cases.
please be one of those, because there's so many times you call a surgeon and ask a medicine case and they're like, oh, I don't know, that's medicine. And you're just like, come on, really, dude?
Yeah.
Let's work on this together. But, medicine, I think the thing is that I think medicine, once you get the algorithm down, medicine's very easy, in my opinion. But surgery, there is nothing ever routine. You never know if you never know what's going to happen when you cut into something. You don't.
Yeah.
You do not. So
yeah.
And congrats to you on that surgery thing. I love surgery, but orthopedics just don't do it for me. And I always feel as if a lot of these surgeons now are just doing nothing but TPLOs. But obviously, the soft tissue surgery stuff I absolutely love. But and I also love really being a surgeon, because I could just go do shifts where I just do nothing but spays and neuters, because you really don't talk to clients, and that would be great. Is there anything right now that you're looking back, you're like 4 months in, and you're like, man, vet school did not prepare me for blank? What would that be right now?
Yeah. I think it is so hard to prepare. I think it is so hard to prepare you for when things go unexpectedly, because you just you can't fake that in a lab controlled environment. When things go unexpectedly with a case, or things have, maybe derailed, and maybe you miss something, like, there are things that you just cannot prepare for until you're immersed in it, and when you're actually going through those experiences. So there has to be some degree of self grace, first of all, knowing that you are not perfect, and that, you're maybe not going to be able to do everything exactly right, or predict everything exactly right, and know everything. So there is some self grace that needs to be had. And also, you need to have a degree of resilience and fortitude in this profession. And that you just cannot prepare for in veterinary school, because you can have all the knowledge in the world, you can have all the finances in the world to do every diagnostic test, and sometimes the disease just wins, and it can be really frustrating, and you have to be able to kind of rebound and learn from it and have that ability to kind of be self-resilient and not self-deprecating of yourself. But there is, like Mike Tyson's quote, everyone's got a plan until you get punched in the mouth. And that happens. I mean, this profession can be unforgiving in times, and it can be really frustrating because you pour your heart and soul into your patients, into your clients. And when things don't go well, it takes chunks out of you. And so it can be really hard, and you just can't, I just simply think you cannot prepare yourself for that until you are actually doing it.
So how many days in before you were punched in the mouth the first time?
I would say like in the first, first few weeks, things just, it's like you said, the cases coming to an academic are going to be challenging, and, a lot of your patients are going to be really sick. And so you can get, no matter what, you do everything right. And sometimes things just don't go well. And so I have, early on, cases were more challenging than, and, you have bad outcomes, and it's just part of the profession. And your goal is to learn from it and, get, not let yourself get beaten down by it. So it happens to everybody, so it's just part of the profession.
When was the first time you've really had, or have you had that moment where you really had to get your emotions in check in the exam room?
I feel like I'm pretty like well controlled in my emotions in general. I'm not one to, I guess, lose my cool much. And I think part of that is attributed to my running, just because you go through so much emotion in an ultra marathon that you have to have control of your emotions in those dark times in order to complete the race and keep going. So I've kind of learned to be very controlled with my emotions and not let my feelings win and dictate my actions. But there's been times where, I usually go into I have to, whenever I speak to an owner, it is always a clear head and it is always the facts. So I've never, I don't think I've ever lost emotional control with, really any owner or anything like that. So if that answers
Oh,
your
that's
question.
good. Well, you're only 4 months in.
Yeah.
And hopefully they're not going to act like that at a academic institution. That's more of a
Yeah.
private practice problem. And you said you
Mm-hmm.
have great mentors. Have they mentored
Mm-hmm.
you on the soft skills at all?
Define soft skills.
Uh, your emotions, communication, building your professional identity, um, you know, all the how to rest how you should reset, anything like that? Or has it all been
Yeah.
pure just cases driven?
No, I would say it's more so the soft skills. It's because it's easy to teach somebody who's graduated vet school. Like, they've proven that they can obtain knowledge and they can learn. So, sometimes there's just a lack of experience, and you just need to, your mentor just needs to kind of just tell you something. And then you're like, oh, okay, got it, I'm there. But the, mental resilience and the ability to, case balance, and yeah, like you said, the soft skills, that has been huge in terms of the mentorship I've had. And I think from different avenues, that some are more empathetic and can help you, if you need to, just go for a wellness walk or something like that. Like, there's a lot of different mentorship you get from different areas, that are more logical and also more emotional. So, I mean, truly, like, surrounding yourself with good mentors and is I mean, you will make it very far in this life if you have good mentorship and can find good mentors and are willing to learn and willing to kind of humble yourself and listen to somebody who has been there and done it and been there before.
Have you ever found yourself so emotionally drained though that you're losing empathy towards either the patient or the client?
That's it. That's a very interesting question, but I don't think so. In all honesty, I don't think empathy, definitely not. I would say more empathetic when you're emotionally drained because you kind of can share it with them, you know? So I would say you're more empathetic the more emotionally drained you are. So, at least for me, it's a good question though. It's an interesting question.
Well, no, it's just because I've done some relief shifts and the empathy I feel is gone in the profession, at least in private practice. So
Mm.
it's good that you still have that because, you
Mm-hmm.
know, if you feel like you're losing your empathy, you need to just take some time, go sit outside and think, why did I do this? You know, and it's to love. Everyone says, oh, because I love animals and I hate people, and that's absolutely the incorrect answer. It's
Yeah,
because you
correct.
wanted to nurture and help creatures that need our help.
Yes.
And if you keep that in your head, you should be okay. Because I know I'm also trying to be a hard ass on you and be a smart ass, but realistically as well, I really like I truly want Jake to be that successful veterinarian who loves the profession.
Mm-hmm.
Because I am a huge cheerleader for the profession. There's a whole bunch of us that are. And
Mm-hmm.
the biggest thing I've seen is that everyone is just so emotionally drained. They're pissed off. They don't care. They don't want to deal with it. And I think they've lost their way. If you could talk to any senior veterinary student right now who thinks they're losing their way just in clinics or getting so emotionally drained, what would you tell them right now?
Yeah. I would say that any any person in this profession that you look up to or you want to be like or that you see as a mentor, they have had these feelings before and they have felt what you are feeling right now, and that it's not uncommon and it is everybody has been through this before. So I would tell them that one, you are not alone, most importantly, because there are times where you are in those moments and the imposter syndrome creeps in and the emotional stress creeps in and can kind of perpetuate those negative thoughts. And I would tell them that you are not alone because everybody has felt like that. Some people just may not tell you that or may not share that. So I would emphasize that, and I would also say that it it is not it does not get it will not get harder. And what I mean by that is that right now is going to be the hardest part because you are in a environment where you are not as equipped yet. It's not that the challenges in the future will be getting any more there will be harder challenges in the future, but you will be more equipped to deal with those challenges. And so that this is going to be the hardest part because you don't have the education yet, you don't have the experience yet, you don't have the maybe the mentorship yet. So that beginning part when you're in clinics, when you're brand new to a clinic and you have just started after being in school for 20 years and now you are working as a doctor, why would you expect yourself to be good at it right away? You have just started. Why would you expect the universe to just be unfair and just, make you good at it right away when you've never done it before? So the more and more you get better, the more resources you acquire, both externally, internally, so that when challenges get harder and harder and you seek higher and higher levels, it's not that you are at a harder challenge, it's that you are just more equipped to take on the bigger challenge, if that makes sense.
Absolutely. Practice makes perfect. That's exactly what I heard out of you.
Mm-hmm.
And it is practice. And it's like, do the whole see one, do one, teach one mantra that I've always tried to instill in all my mentees for over 30 years. Whether I was mentoring, like when I was a technician and I was training new technicians, all the way to when I was, a multi-practice owner, I would always do the see one, do one, teach one, and I would train everyone underneath me the same concept when they were training people. It is because the idea, you almost had to be perfect to get into vet school, and that imposter syndrome hits you a little bit senior year, but definitely when you get out, because you're like, I don't know what I'm doing, and that's absolutely incorrect. You do. You just got to trust yourself.
I remember, I believe you were saying this last time, is that when we were kind of talking about a similar topic, is that you may think that you are kind of out of your depth, or that, you're like, do I deserve to be here, or am I, am I incapable, or those doubts. But it's like, you wouldn't be here, you wouldn't have graduated vet school if you were incapable. There is a natural, essential selection process that occurs where, if you can retain the knowledge, and if you can pass boards, and if you can make it through vet school and get into vet school, then it's like, what, that right there is the proof. There is no other proof you need to tell you that you are capable of being a veterinarian, and you are capable of being a very good veterinarian. So that's one thing that I always fall back to, which is kind of a new mantra for me in my internship. Before, I used to always say to myself, when things were hard, I would say, this is what hard feels like.
Yep.
My new mantra is, yeah, I got a new one recently. It's that I want to get good at this, and I'm trying my best. So it is a purpose, and then also it is a self-grace directive thought. And I think about that daily.
Well, you got to be your biggest supporter. Mentally, physically, spiritually, you name it, you got to be your biggest supporter. Because if you don't love yourself, no one else is going to care to love you as well. And if you don't love yourself, you're not going to be able to give the effort that's needed for this profession. How many other people did you cancel on in the past 4 months besides me?
There was just one other one that I was going to go on. It was a running podcast, but I'm still planning on going on that one, but it was the same where I had to cancel. So it's not you, man.
Okay. How's your dating life?
Dating life is, good. It's hard when you're going to potentially, like, I don't know if I'm staying here. I would love to stay here. But it's hard when you don't know if you're leaving. So it's hard for me to really, put maybe effort into wanting to pursue something. And also there is a hard time management piece of this when it comes to being able to go on a date. If I'm canceling on podcasts where I'm trying to help people and give my advice, going to a sushi bar and getting dinner might not happen.
Are there any other cute interns?
I have actually kind of a strict rule that I do not date or flirt with anybody in the hospital. So I try to keep my life professional at work.
Hey, hold on a second. You say I'm not professional? I married my classmate.
Hey, to each their own, man.
And we're almost at 30 years, dude. 30 years. Yeah. Well, because it's hard. I mean, let's say you date during your internship. Let's say you do date outside of the veterinary world. no one's going to understand the hell you're going through. No one. And when you do cancel that date because of who knows what, they're going to be freaking pissed or just write you off. So
That's so true.
So do not, don't cancel that one out yet. Maybe find someone who's like a third-year resident surgeon who's going to make like a boatload of money because she's going to come up with some crazy type of new technique, and that's your sugar mama. And then you can go just vaccinate puppies and kittens in Hawaii.
I'll keep that one in mind.
I'm just saying there are things you can do. There's definitely things you could do. But you know what, sure. Jake, I just want to thank you for the quarterly check-in. And I really think, the last question I really have for you, is this still the dream or has the dream changed?
It has never been more so clear in my head that this is the dream. I could be at work all day, every day, and, mentally exhausted and pushed, and I could not be happier. I think I love asking people this question is what in your life makes you the most happy? Because everybody's definition is different. My definition is when I get done from a long, long day where I am so mentally drained that I feel like I can't do any more work, and that I feel like I lay down in bed and I'm like, I have made it much closer to my goal after a hard 24-hour fought day. That is makes me the happiest, and that brings me the most joy, and I am immersed in it right now. I couldn't be happier with where I'm at. I couldn't be happier with what I'm doing and who I'm doing it with.
Well, I tell you what, Jake, as always, I'm always here if you need someone to talk to, because like I said, cheerleader, that I'm academician now, so I'm a cheerleader from the outside. But I've been through it. I've done all of it. It sounds like so far so good. I want you to keep up the good fight. I want you to keep learning. I want you to do all the things you want to do, but just remember that there's those of us who are there if you have those bad days and you need someone else other than your mentors at school to give you a swift kick in the ass or a pick me up, because that's what we're here for. And I really think, as far as these check-ins, I think it's going to be very beneficial for all the young veterinarians that are thinking about internship or just started, because there's no difference between what people are going through. Your classmates that went right into practice and what you're going through. The difference is that they're dealing with it real time and referring those cases to you that are a little harder.
Mm-hmm.
How is Georgia versus Wisconsin? I'm just curious.
Oh yeah, I mean, I love the weather here right now in the fall. It's like couldn't be better. It's beautiful. The city is really great. But I will say, man, in the summer it was a shock how hot it was every day.
I told you.
You want to talk about
I warned you.
Yeah. I'd say my running took more of a toll on not being able to do it as much, solely because 4 miles in, I was in hypovolemic shock and heat stroke, man. It was like brutal. Yep. So this last race I did, it was over 90 degrees all afternoon. So it was a 50-mile. Well, I ran 52 miles. It was a 12-hour race. You have to run a 4-mile loop and you run as many loops as you can in 12 hours. And pretty much the majority of the race was in the heat, and like there was no shade coverage. It was all sun. And so I would be running and I would just have to, here I am from Wisconsin, I don't belong down here. And I would have to like throw my hood or my shirt and make like a little hood to cover my face. And I would just be running. And as soon as I would get back into the aid station, I would sit down and the workers of the race would put ice packs on my back and my neck, and just to cool me down, man. It was like the heat here is no joke.
Yep. It is and the thunderstorms are pretty wicked too.
Yeah. That's another thing too. Although I love a good thunderstorm.
Oh yeah. We don't know what those are here in Southern California. But hey man, I'm going to let you go. I know you got an overnight tonight. I want to thank you for finally making it on. I didn't know if I was worthless to you because you canceled on me 3 times. That's the Jewish guilt trip, by the way, that I just gave you. But everyone listening out there, if you want to get a hold of Dr. Jake Rostas, because you have questions about internship, how should they do that?
Yeah, just my Instagram is probably the best way to contact me, which is just at Jake Rostas. Rastas is my last name. So if you have any questions, happily, you can DM me or, message me. It's whatever. I'll happily share any sort of insight and give any advice. And if anybody wants to talk about running too, I'd happily talk about that as well.
And if he ignores you, you can always get a hold of me, and I can get a hold of him as well. Just go ahead and hit us up in the comments or the DMs if you have any questions, because like I said, people like Jake who's just starting, and people like me who are on the outside looking in and trying to give support. We're all here for you. And again, thank you for listening, and we'll catch you next time. Thank you, Jake.
Thank you.